It's shortly past 5. Let me first of all, welcome everyone. Welcome to the panelists who I will introduce shortly, and also to the attendees. This is a very special, we've never done this before, so a free screening of Pandora's Box, the movie, followed by this panel discussion. And I hope you all enjoyed the film. This is happening on the occasion of Menstrual Hygiene Day, which is happening in a little bit more than a week on 28 May. And we really want to thank the sponsors who really made this free movie screening possible, because usually it costs you money. So this is a big thanks to the Case for Her and Diva International, DivaCares. Thank you for this opportunity. So I would like to introduce now the panelists. We'll have about an hour, but I don't think we want to spend that much time. We really also want to take the opportunity for you to ask questions and reflections on this film, because that's should be a dialogue. So we have with us this afternoon Marni Sommer. She is an expert and researcher on menstrual health and hygiene. She's a professor at the Mailman School of Health at the Columbia University. You've seen her in the movie saying very smart things. So thank you, Marni, for joining us also for this panel for more questions and more insights from you. We have with us also Christina Youngberg. She's the co-founder of the Case for Her, which is an investment portfolio into women's health, including menstrual health. And she's also very passionate about documentary film and is a co-founder and a partner at Influence Film. Exactly. And our third panelist is Karine Chambers-Saini. I hope I spelled this correctly. Yeah. She's a co-founder for Diva International, and that happened already 15 years ago, so very, very early on.
2002, 20 years almost.
Yeah, exactly. As you've seen, Diva International has been a co-producer for the film, and we're going to ask her some questions around it. So, okay, so let's start the round of questions, and everyone who's here, please use the Q&A to also ask questions, come up with questions. We'll pull them out later to ask to the panelists or to other experts who are also here. I can see some of them. Okay, Marni, to you. Putting you on the spot because you've also been in the movie. Would you mind sharing with us the reflection on the movie? And I have a second question. We heard the term menstrual equity and inequity a few times throughout the film. Can you explain to us what this means in detail for you?
Sure. Yes, it is an honor and a delight to be here. I feel like we are officially kicking off Menstrual Hygiene Day, although I don't know what the official date is, but it feels like my first official activity. So just a few thoughts on the film and what I found so remarkable about it. First of all, I love that there's so many people online here to discuss it, and I look very much forward. I hope nobody will be shy about including their questions so that we do get to hear what you're thinking about, what your comments are as we go along. I think my favorite thing about this movie, aside from how wonderfully well made it was, is the sweeping way in which it covers the issue. So what I mean by that is it captures everything from the issue of just basic rights and what we should all be entitled to as a very basic human right around our needs to take care of our bodies and feel good about our bodies, to that sort of issue of how it does feel good to feel in your body if you cannot take care of it and manage your period each month or however often or not often you get it, and in the different circumstances of people's lives, the way it takes us on a journey from incarcerated women to rural villages in what looked like East Africa. I know Kenya was in the movie. To girls in school in India, to trans folk, just the sort of journey to the legislators in different countries, and just sort of this conversations around how people all over the world are struggling not all of them, but those who are struggling, it is this sort of universal experience that we all deserve the ability to manage. And so that journey we follow along, it's the beauty of filmmaking, is we get to travel without leaving our living rooms. I think another thing that I found very powerful about the film is this continuous coming back to a term I did not coin. My longtime early colleague in this space, Archana Patkar, used to always say, which is breaking the silence. And I think while we all rightfully get very interested in issues of how do we make sure toilets are more safe and clean and accessible, or how do we make sure all people who menstruate have adequate menstrual materials. We talk about all the components, but underpinning all of that is the stigma, the silence, the sort of shame that people are taught about their periods, the need for it to be invisible, to have sort of manage it without sort of being open about those needs. I love that. I'm not sure everybody around the world recognized the actress, but the very famous female actress who, when she was on this red carpet, which gets 1 million people watching at the Film Awards every year, mentions not only all they ever want to do is talk about your fashion, and she talks about what she's wearing and the tampon brand, which, and then the woman recoils from her. And so I think when we can start to talk about periods and with full respect that cultures and societies are at very different places on this, and if you don't want to talk about it on the red carpet, that is absolutely okay too. But that if you are in a country where people feel they want to be able to talk about it that openly and not have it hinder their everyday experience, I think that breaking of the silence, the normalization of it, one of the things I love that they highlighted, everything from women becoming entrepreneurs and making pads, which automatically creates a conversation, creates a sense of empowerment, to the young musician in the UK running the marathon and showing the blood. And as I was watching the movie, I don't know why I never thought about it before, because I've certainly read and heard about her. I was thinking, isn't it kind of like a man sweats when he's running? And nobody remarks at the fact that there's sweat on anybody's body as they run a marathon. So why should this really be any different? That is a natural part of your body. And so I think that normalization, whether it's in schools or families or on TV or in product advertising, is really sort of an underpinning aspect of this movie, that we need to be able to normalize and talk about it with full respect for, societal differences. And then I think, just to get to your, sort of the equality of the issue, whether you are a young person getting their period for the first time, you are somebody experiencing homelessness, you are incarcerated, you are someone with a different type of disability, whether you're a celebrity, everybody is sort of captured and deserving of what, if we come back to the menstrual equity question, being able to manage your period, your menstrual blood flow in a healthy and dignified way. And Jennifer Weisswolf, who's obviously figures prominently in the movie, she's a wonderful advocate for this issue, coined that term. And it's wonderful that so many people have picked it up. But when you think about menstrual equity, how do we ensure that everybody who gets their period can manage in a healthy and dignified way? You immediately go to, but there's so many barriers. And that's when you get into the inequities of somebody. And we did research in New York City of people living on the street, and this was pre-COVID, the inadequate access to toilets and menstrual products. When you think about those who are incarcerated, and the power differentials, and being seen as less value, not being respected in their basic needs. So I think any of the barriers, from a young person who cannot talk to her parent about it, or so there is no one to support them and make them feel confident about their bodies, to those who live in much more extremely vulnerable realities. And so I think the menstrual equity gets at this issue of all the barriers that hinder all of us from managing our periods in healthy and dignified ways. And I feel like I talked plenty. I'm going to pass the baton. Oh.
No worry, Marni, that speaks to the movie. Because yes, even for us who are dealing with the issue on a professional basis, on a daily basis, it still triggers a lot of thoughts. That's why I wanted to turn to Carinne as a co-producer of the movie. So why did you do this film? What did you want to tell in the story? And then can you share a little bit how the movie came about?
Absolutely. Well, we have been part of this kind of menstrual education and equality movement for 20 years, really, since we started DivaCares in 2002. And it's something that's really become more formalized in 2019 for us, but that became so urgent and timely as more and more partners that we were working with, we were seeing these stories. We were really understanding that there was so much more to this work, and there was too far to go. There wasn't enough people really understanding what this was all about, why they should care about it. And that's kind of how the film really came to life, because we felt that there was lots of amazing advocates, amazing organizations doing the work, but how can we elevate those voices and really create content that will get people really learning and educating and caring about these issues. So that journey started in 2017 when we started creating the film. It took a really long time. It actually started as a much smaller project. We didn't realize it was going to be a full-length documentary, and we ended up with over 1,000 hours of footage. It was filmed, as you saw, in 5 different countries, different continents, really trying to do justice. And every time we kind of dug in, it was like, it never felt like enough. It was like we needed to represent these different voices. So, and literally we could have even had thousands more hours of film, because there are so many stories. And that's kind of where the podcast also came from. And it's just the beginning. It's really just creating that movement and getting everyone excited. And I'm reading the comments and seeing people from all over the world and different organizations. And I think it's just amazing. And that was our hope, that with screenings like this, and by creating this content, people will really start to relate and have empathy for all different aspects of challenges that women and people who bleed are facing around the world.
Thanks, Carinne. I totally second. And dear participants, if you have a question to Carinne, please place it in the chat box or in the Q&A. I probably, you have now a lot after you had 1,000 hours. And really well done to cut it down so concisely and still be true to the story. Well, yeah, and I want to ask Cristina, who is like a little bit similar to you, Carinne, but also her heart is really in both fields, in documentary films and in women's health and menstrual health. And we've seen now a couple of movies and films like Padman, which was featured also in Pandora's Box. Then there was Period End of Sentence, which you heard who won an Oscar for Best Documentary, Pandora's Box, actually all around the same time, like 2019 and until now. Cristina, why do you think film is such a good way to bring the message across of the challenges and of women and girls and people who menstruate and also the opportunities that are there?
Well, first of all, I just want to say, or clap or celebrate, I mean, to imagine that the two things that I'm really passionate about, documentary film and menstruation, are really meeting here today. And to see a film like Padman and of course Pandora's Box and Period End of Sentence, you know, that's just such a sweet spot for me. So happy to be here. And I want to say thank you, Ina, for hosting us today, and a specific shout out to Marni, who's one of my heroes. And I don't know if she remembers, but she really inspired the origin of the case for her, where we've been funding across the menstrual health space the last few years. So thank you, Marni. I think one of the things that I like to say, and I don't know if it's true, it must be close, and that is, if there's one thing that's more underfunded than menstrual health, it's documentary film. So I just am so thankful that Carinne, you have produced this film. And just to say that anytime you see a documentary, it's a labor of love, but to make a film about menstrual health, one of the most stigmatized women's health issues, is an absolute feat. And when you said it took a long time, I figured you were going to say 2005. So hats off 2017. That's just an absolute miracle to have made this film across 5 countries in 1,000 hours. Oh my gosh, unbelievable. But to your question, Ina, I mean, film is such a magical opportunity because I think we all know, maybe even without knowing, that it's not facts and figures that moves people to change, to make a real change, whether it's an individual change or a change as a community or as a planet. It's actually narrative and storytelling, and it's one of the most strategic investments that you can make if you want to make a change. So again, this film Pandora's Box is really a gift to this community, really fighting and trying to push the issue of menstrual health forward. So I would say double down, community, double down team, use this film to make the change. But again, I mean, it's the stories, we're made of our stories. It's what makes us human. It's listening to other stories and creating that open space where we can empathize with others. So yes, just magic in this space. And I'll end with putting on my menstrual health funding investor hat. Again, documentary films are really, they're scalable, right? I mean, it's such a huge opportunity. I mean, I can't even count how many different countries are represented just on this little panel discussion, but a film is replicable and scalable. So just want to advocate for more documentaries about these important issues.
Wonderful. I have I move forward to Marni. I skipped a question for you, but I turn to Carinne because I think the question flows very nicely. Carinne, you've beyond the film, you now explored also podcasts.
Yeah.
Can you also a very popular way to reach people at scale? Can you tell us how you came about it, what stories you tell there, and so on? And audience, please shoot questions. It's soon your time.
Well, and again, I got excited at the beginning as we jumped right into it, but I just want to say thank you for putting this on, Ina, and it's such a pleasure to be with Marni. We were actually on a panel together at Yale maybe like 4 years ago or something like that. That's when we met. So pleasure to see you again. And Cristina, hello too. And I just also want to do a quick shout out to our director, award-winning director, Rebecca Snow. She is absolutely incredible, and she has, like, without her, this film would not be like the artistic and incredible piece that it is. So I just have to give her credit for that. And so as far as the podcast, we had, first of all, tons and tons of extra content and stories that we couldn't fit in. Also, there was a lot of things that had happened since we wrapped filming the film, and the landscape is just shifting daily. So we felt that that was another platform we could continue the story and to also elevate these stories. So it's definitely a lot. I think there's 6 episodes, they're about an hour each. Tons of very, very fascinating conversations and interviews and other advocates featured around the world. And I highly recommend that everyone take the time, especially if you're in this space. It's a great another resource, and another way too, if you can share it and highlight these stories will help the movement and help people become interested in it and help us to normalize menstruation, normalize these conversations and period stigmas and taboos. And I think the biggest thing, one of the biggest things is, as periods are a barrier to education. Even in Canada, 1 in 7 girls can't afford menstrual products. And you think, like, how is that possible in a country like Canada? But it's happening all over the world. So there's definitely a lot of work to be done. And I just love that the podcast really engages in more meaningful conversations around menstrual equity and beyond the film.
Yeah, and there are a few, thank you, Carinne. We assumed there was much more beyond the film. There are a couple of questions in the Q&A to you, especially about what didn't make it into the movie. Maybe you can answer to those, or we hold off until we have a few minutes. And you gave me a perfect springboard to my next question for Marni, because you said so much is happening on a day-to-day basis. And we also seen that. I mean, I guess when you shoot the film, then suddenly were all these movies coming out, suddenly all the news came out about UK and so on. So Marni, we're really interested and to ask you this question, because as an expert who has a great overview. So where do we have seen progress over the last years, and where do you see the big, not the biggest, and the big gaps on where menstrual health and hygiene still needs to be tackled? Yeah, it's a big question, I know.
Yeah, you know, sometimes, and hello, yes, Christina, I've not forgotten our very long brainstorming session many years ago around the corner from my apartment. Sometimes when I'm on a panel with such enthusiasts, I'm like, we don't have that much to do. Look at all this enthusiasm. We have a documentary film. We have great questions. We have government people from countries online. But unfortunately, although I do think we've made tremendous progress, and I think films like this really contribute to a much broader conversation, which is what needs to happen if we want to see an actual shifting of the curve, as it were, in terms of societal change around this issue. We do still have a fair amount to accomplish, and I think that COVID has not helped that reality in some countries, or in many countries. However, to speak about the progress first, I think obviously there's a much bigger conversation. I think if you go back to when Carinne probably started out on this journey, there hadn't been a film that won an Oscar. Governments maybe hadn't written their menstrual health policies yet, or they had them, but they hadn't implemented them to the extent that they're starting to. There were social entrepreneurs starting to tackle the product issue. We have seen change. We've seen change around conversations, governments taking this on, NGOs, non-governmental organizations taking it on, a popular discourse around it, not in every country, but certainly it's in the media here in the US a lot, and in the UK and some other countries. Canada, I think it's in the popular media sometimes. I don't know how often, since I'm not there. So I do think, and the other thing we've seen is that sort of the global South writ large, and all the action and forward thinking that was happening there around starting with girls in school and then broadening out to larger sort of countrywide needs. And yes, there's still work to go, then eventually moved over to the wealthier countries who finally started to pay attention and have come at it primarily in looking at the tax issue and the legislation issue, which is great. And certainly that needs to be tackled, but we certainly have not gone as far as countries that have thought about, like, what do girls know growing up? What are they learning in school or not? What are the issues? You know, what are their interactions with the healthcare system? So I think that we've made a lot of progress. There's conversation around it, there's programs around it, there's some research on it. The silence is being broken. I think we have, and it is now the whole globe, maybe not Antarctica, but, you know, it's mostly penguins there, so it's okay. You know, but when you think about how far we are to go, I think a lot of it comes down to, yes, this continued effort to tackle the silence around it, the invisibility of the issue. If you don't get your period, I think oftentimes intentionally or unintentionally, I think is often the case, you just don't incorporate it into your thinking when you are designing buildings or infrastructure or programming or messaging. And so I think we need to go a lot further in the bringing it into the conversation, the bringing it into building design, the bringing it into product availability, the bringing into sort of the everyday. I think if you look at it from the lens of a researcher, we know a lot about the barriers. We don't know a lot about the barriers documented, for example, from incarcerated women. We have wonderful stories, and I 100% agree with Christina. The power of storytelling is magnificent. But we don't have a lot of documentation of some of these things, rigorous documentation. And it's not that I don't believe these things are basic rights, and it makes me frustrated sometimes that we have to document them. But if you don't document them, then convincing those with the budget line items that this is worthy of investment, that this is worthy of resources in comparison to something else is very hard to do. And so I think there's still a need to document what's going on in communities, what's going on in, let's say, informal settlements and rapidly urbanizing parts of the world, what's going on, so I think we need to understand more about the lived experience of those managing their periods, in particularly the more vulnerable or in challenging environments. And I think we don't have a lot of evidence on what works best and what's the most cost-effective way. So if you are thinking about interventions in schools, if you are thinking about interventions to make, yesterday I went a rabbit hole, and if anybody wants to do this, go for it. I'm like, why do we not have vending machines all over New York City where you can get condoms, sanitary pads and tampons, pain medicine, and we could throw in like masks and hand sanitizer now. But then my team, I literally made them spend half an hour being like, now, is that a business case? Is that a public health investment? And why would they do that? But I just want it to be this ubiquitous thing where we have figured out how do we best reach those living on the street? How do we best reach those? The best way is them not to be living on the street. But putting that aside, how do we make sure they always have access to bathing spaces, laundering, and toilets? How do we make sure they feel safe when managing their period, whether they're street dwellers or slum dwellers, in parts of the world or in New York City? How do we best reach girls in school? I was very struck, or all young people menstruate, with traveling to India in this film and what gets taught or not taught in schools. And right here in the US, half the states in our nation do not mandate sex ed. And even here in New York, girls are not necessarily getting education, or young people, about puberty. And so we have a long way to go in terms of coming up with more effective interventions, documenting that they make a difference, so we then can move to those budget line items to get into people. And then the last thing I'll say is, because I was on a call for 3 hours this morning about this, we have an effort trying to improve national level monitoring around the issue of menstruation and menstrual health and hygiene. And what we are basically trying to do is, governments have so much to monitor, they have so much data they have to collect. So we're just trying to come up with a basic list, a very, very short list of indicators that a government could be collecting at the national level, so not program level, national, to say, look, we are making progress. We are moving towards a shift in this country around the issue of menstruation. This particular project is focused on girls for various reasons I won't get into today, but it's like it's just the tip of the iceberg. There's much more that needs to happen. But I think when governments have to start to monitor and link it to line item budgets, then you start to see, and then combine that with the power of social media and social norms change, perhaps you will then start to move the needle in an even bigger way. So.
Yeah, thanks, Marni. You raised a really important point. We need to show where we're making progress. Besides the stories, I think it's great to combine both the stories that we have with the challenges and what's been done, but also then put it together with data that they can still show the gaps and also hold governments accountable or donors accountable and target interventions, especially when we want to leave no one behind. Data can help us. What we probably already know, that there's a lot of people who are not benefiting from interventions, but it's good. And that's what I like in the movie. It really shows a lot of the people who we hardly talk about, because we always talk a lot about adolescent girls. And then the movie covered a lot of the other spots that we have to consider, because menstruation happens from menarche to menopause, and it's happening everywhere, not only in school, but also at home. I'll take a question related to that, but I first want to ask Christina a final question, and then we go to the Q&A. Christina, Marni said, yeah, we are ambitious. We want to go to scale. There's monitoring now, but funding is needed. And I would like to, again, you're one of the dedicated funders for menstrual health and with a dedicated portfolio. And after watching the movie with your eyes, and also I think the audience is, the participants are really interesting what you think is needed in terms of increasing funding into the issue, or you can also tell your personal story, what made you fund the issue. But yeah, how do we get more funding for the issue?
Well, I thought you were going to ask me what we needed, and I was going to say money.
That was a bit too easy.
And I mean, I think, yeah, I think we're all in agreement. It's just like documentary film, like I said, massively underfunded in the menstrual health space. And so I just want to be clear about that, because I think there are all sorts of different types of funding. Of course, it's great to get more donor funding in the space, and absolutely research. I agree with Marni, the evidence base and the research and the evidence is massively, massively needed to move more funding into the space. But we also need more investment. And I think if we really start to kind of break it down and look at what kind of investment goes into menstrual health, or even just femtech, or even just to like women-founded, women-run businesses. I mean, the inequality, the gender inequality is just absolutely insane. So I think we need to be normalizing and mainstreaming these really highly stigmatized, taboo women's health issues, because if we're not actually talking about it, then it's not going to get funded, because it's basically a bunch of men that are unfortunately deciding what gets invested in. And if we don't say that we have needs, and if we're not talking about it on a daily basis, even one-on-one at home, you know, we're just contributing to the stigma. So I would say, come on, guys, let's normalize periods, menopause, women's sexual pleasure, safe abortion. Like, we just have a list of work to do. So that's just kind of a call out to everybody who's on this call. Second to that, or next, I would say, you know, my partner Wendy and I, we've been funding in the menstrual health space for a number of years, and it's been a real journey, and we've had a lot of aha moments. And one of the big ones and early ones was that it's not one size fits all. It's not free pads for everyone. There are things like cloth reusable menstrual pads and menstrual cups, and it's not about choosing which one is the answer. I think it's about choice. And, you know, we might want to use a myriad of things. And I think women and girls deserve to decide what's best for them. And it might not even be just one choice. So I would say we're always thinking about really design thinking, using human-centered design, co-creating with adolescent girls in this case. They know what they need. We actually don't need to know. We just need to enable them to communicate and advocate for what they need. Again, scale, whether it's film and storytelling, or technology and apps, or education. I think we just always have to be thinking about that, especially when you're a funder, which was your question. And I think with menstrual health, it's one of those magical opportunities where it's so ridiculously cross-cutting across health and education, gender equality, water and sanitation. Unfortunately, it does get siloed. So I think one of the things that's on our mind, in addition to moving funding, is what are those kind of intersections? What's the intersection of menstrual health and WASH? Or what's the intersection of sexual health and reproductive rights and menstrual health? And how can we inspire those spaces and leverage MH to have better outcomes, just kind of across the board? I'll leave it at that. I could talk for hours.
We all can. But there was a question that I would like, because you talk about cross-sectoral, and as we all said about like being holistic. So there was a question from the audience, and please shoot more questions because we go into the open question round. It can be a question to all three of you. So how do we think we ensure that the conversation becomes this holistic conversation and goes beyond the girls, but also include aspects like menopause? So the entire menstrual experience, basically.
So I think that's a terrific question. I have been gathering a literature data, we're trying to find space in my calendar to dig into perimenopause, which I am in myself, and menopause, because I don't think I appreciated it until I got here. So I'm just catching up. I just haven't had the bandwidth or time, but
I'll join you on.
I think, huh?
I'll be on that journey with you.
Yeah, no, we have a lot. I mean, so I think we absolutely should be talking about the life course, and it's something that internally, I know at least my team, and I think others as well, have sort of committed to ourselves. We're going to start trying to think across the life course in the coming years, now that there is starting to be a significant swell of people working on menstruation and now that there is movement there, I think there is more space to expand it outward. I mean, I think, frankly, I have tried for 3 years to get a little pot of funds to look at the issue of menopause with a colleague in Nigeria, and just trying to figure out how to pay for it. Nobody wants to pay for that research. I sent a bunch of emails in the last week, again, to try and explore which big donors or scientific researchers might be willing to fund some research around abnormal uterine bleeding in East Africa with a partner, and no interest, and so we were having this frustrating email exchange, like, don't women's bodies matter, or people's bodies matter who have these things? And so I think this is a long way of saying I totally agree. We need to be looking at the life course. We need to be breaking the silence beyond periods to all the other bleeding related experiences of people from menarche to menopause, and also about menopause and perimenopause. I do know there's a number of popular or physician written books coming out on menopause here in the US, just in this year and in the coming years. So that's great. But to me, that doesn't get at understanding, but what is that lived experience, and what is the dynamic with the healthcare workers, and what do people learn or not learn, and what do we have to learn in different societies from each other around that experience. So I think 100% agree we should be looking holistically. I just think we haven't had the resources or probably enough people working on this issue. But I do hope that myself and other people as well, I know, are interested, start to tackle some of these issues in the coming years.
Yeah, I think that's really fantastic, Marni. And to add to that, what we're seeing a lot with some of the organizations we work with are other health issues like endometriosis that are not getting diagnosed. In Canada, it takes an average of 10 or 11 years to get an endometriosis diagnosis. And these women are not being heard. They're not being heard by the doctors in the medical community. And it's like, oh, well, pain is normal, so you're fine. There's nothing wrong. It's like, there's so much more to these issues. And you think about that around the world where women aren't having their voices heard, and there's like debilitating issues and pain, and where like they can't function, they can't work. It's just being dismissed. Yet, if it was a problem happening to men, that would not be the case. It would have been figured out. It would have been solved. It would have been, prioritized. So how do we continue? I think that's one thing I heard Jennifer Weiss-Wolf talk about, was that even with the tax legislation in the US, that's just kind of an entry to start these conversations. But the whole point is that this is really just at the beginning, and we're at the precipice of bringing all of these issues into the forefront. And that's kind of where we were thinking, and that's actually where the name Pandora's Box came from, because the Pandora's box has been opened, everyone. It's like all these, it's just kind of unleashing all of these issues that's really at the intersection of education, justice, and all of these policies around women's health around the world. So I don't know what the answer is. I just know that we have to keep having these conversations, and if there can be more funding, I think it should be coming from the government that should be funding these issues. But obviously we're not going to wait around for that to happen. So we're going to keep doing the work that we do. And as a social entrepreneur, we're trying to do our part. Since our inception, we've served over 360,000 periods and donated $1.2 million in product. But again, like, that's not a solution. That's like just one tiny little sliver. And also, cups are not for everybody. They're not always feasible in different places around the world. There's just so many issues. I don't know how to make it more concise. I could also talk about it for hours, but I think the point is that we need to just continue making sure that these issues are brought into the forefront, and panels like this, events like this, and we keep doing the work. That's really all we can do, and try to get the attention of the policymakers that are making these decisions and responsible for education, healthcare policies, and, you know, all these different issues.
Thanks. So yeah, and movies like yours, maybe there will be a movie about perimenopause soon, or
Yes.
other stories.
Part 2.
There are a couple of questions to you around monitoring and indicators in the Q&A and in the chat box. Would be great if you can answer some of them, because they're quite specific. And I don't want to miss the opportunity while we're still here to still ask Karine, because we had a couple of questions to you about the movie. So that I want to make sure we got it answered. So how can it be being seen and shared by others? What's next for the film? Is there plans to getting the story to more governments, politicians? So what's your broad vision for Pandora's Box? How can we, after today, still promote the movie, access the movie,
absolutely.
use it for educational purposes? That would be great for you to answer.
Yes, absolutely. This was a lot more complicated, and I never thought that it would be so difficult to get the movie into distribution. Interestingly, Netflix said no to us because they said, well, we already have a period movie. As if like, okay, you have like 200 different action movies, but you can't justify more than one period movie. But it's like, oh, well, we've checked that box, so this isn't important enough. So even though they're completely different and different stories, and it's just unfortunate. Hopefully they'll come around. But in the meantime, the film is finally in distribution. It's available on like Apple and all the streaming platforms. It's actually linked to on our website, pandorasboxthefilm.com, or you can find us on Instagram as well, where you can find out how to stream it. If you're an educational group, you can reach out to our team via the website or the Instagram page, or through DivaCares, and we can connect you. We have a separate team that's helping to coordinate the screenings and different things like that, and find out how we can support you in that. We're trying to navigate this whole thing. So we did the film, the podcast. Now that it's more widely available, our goal is to just keep promoting it. We've allocated a significant amount of money for next year to continue promoting it, because we don't have any funding. We 100% funded the movie ourselves, and are continuing to fund the education and promotion of the film. And, you know, I've got lots of ideas in my head. There may be a book coming down the road to build on it. There could be a part 2. Like, there's so many different things I would love to do in time. But in the meantime, we're just doing our daily work and trying to be a sliver of of what we can contribute to the movement, along with many of you. It's not, there's not one company or person or group or anything that can really do it. There's just so much, it's so ingrained that we need to all do our part.
Thank you, Karine. That's good news. I totally agree. I mean, I think it's all about, and we see here so many partners with whom we collaborate and work together. I always see, or what we explain for Menstrual Hygiene Day, it's like a choir. We only are as good if we work together collaboratively, and only then it's still a niche issue. And maybe there's another streaming platform starting with an A that has more interest in the movie. There's a second opportunity for those who still haven't watched the movie or want to share it with your friends and family. Lindsay from The Case for Her has shared the link on the May 27th and May 28th. Easy to remember. There's another opportunity also with a panel that DivaCares International hosts, linking menstrual health with mental health, which I think is still a very unexplored but opportune moment, because it's also Mental Health Awareness Month. So really coming together and looking at that. So feel free to, for everyone who's attending here, to share the link. The more people watch the movie, the better. And join these discussions. We have 10 more minutes. I still feel like we could talk forever, but I also know Marni needs, so I'm plugging out some of my favorite questions here. And please, if you still have more, do. And whoever wants to answer, answers. There's a very good question from Samantha about visibility of the intersectionality. So how important is it, especially for non-white women, LGBT folk, and in the global South, to be present in international conversations like this? And also how do we make sure we do feature those important voices and representatives?
So I think that's an excellent question, and I'm sure the others have great thoughts, and I appreciated that the film seemed to do a really good job itself of being very, very inclusive. One of the things we've tried to do, although as always, we all do everything imperfectly, our Period Posse webinar series, which we do maybe 4 to 9 a year, we try to identify speakers from all over the world, just to make sure that we are capturing perspectives from people doing the work, living the experience, who really can speak most accurately and beautifully to what the issues are in their given context or in their given world. So on that, we're always interested in hearing recommendations for topics and or speakers. Our only challenge can sometimes be time zone, but we try to do our best to pre-record if people are in very far away places. So so that is just, oh, thank you for putting it in the chat box. That is one aspect. I don't know if the other, I was going to say something else and then I got distracted, but do others have thoughts that they want to add on that?
Well, I think it gets back a little bit to the conversation we were having before, and really just focusing anytime, at least my perspective is as a funder, investor, and grant maker, and that is to not show up with any solutions or quick fixes. It's about co-creating and really just empowering local organizations, grassroots organizations, and individuals to address those needs, and to just get out of the way. I think is what we try to do.
I agree, and that's what I also liked about the movie when I watched it. Also, congratulations, Carinne, because you showed that there are so many different solutions out there, and yes, there was a lot of discussion about products, which is a big need for many of menstruators, but you also saw that there's choice. There are different options depending on where they are. So yeah, I second you, Cristina, and it needs to be localized and tailor-made, and listening to the people we serve, or like people not we serve. I find this always like, oh, we serve sounds bad, but I think not coming from the outside with predefined solutions is best. And I want to ask then also Priyanka's question, maybe also good for all three of you. So there are areas we have no access to TVs where this kind of documentaries can be shown, or in they just television ads are more classical. So how do we reach them? What good communication tools are there also to involve the entire family?
So go ahead, Cristina.
Well, I was just going to say, I think, you know, what we need to invest in here is, again, removing the stigma and the taboo and normalizing and mainstreaming some of these highly stigmatized health issues. And that can be effectively done in such a myriad of different types of media. Of course, feature-length documentary films is really a special animal, and it can be a bit difficult, although there are fabulous NGOs that do remote screenings and you know, set up screenings on a community level. But I would say, I mean, radio, TV, I mean, all of it, and not just education or documentary, but we need to see these real life situations actually featured and given space in dramas. Also, you know, I loved in the movie where it was featured, Carinne, Courtney Cox says the word period for the first time, and you probably remember whatever year that was, but it's so seldom that we hear about periods and perimenopause, and again, like a safe abortion, never. I think, yeah, any media is quite useful in changing the narrative.
I would only add, one of the things that's been really interesting during the pandemic that we were able to continue doing is we have puberty books in different countries, and we were trying, because we've been partnering NGOs and ministries of education, UNICEF and UNFPA have been distributing these books for many years, but we thought, well, what's another way we can reach young people that maybe isn't through education systems, and this just to go beyond what we'd already been doing. And so we started exploring uptake through churches. Our plan was to explore with mosques in Tanzania, but COVID hit and then everything sort of shifted. But one thing that was really neat that we found through the churches is because the puberty books include content on menstrual health, menstrual hygiene for girls, and then also in the boys' book include some content on menstruation and how both young people are trying to figure out their bodies and feeling embarrassed and all of that. The idea of approaching the churches and seeing if the pastors wanted to advertise them or promote them or use them in their youth training or whatever it is might be a viable way to reach them. We didn't really get a huge amount. I mean, we got 12 churches ordered copies, but we approached a lot more. And I think if we'd had more people on the ground, it would have gone further. But one of the things that struck me was, because we did some evaluation of it, was the number of parents and caregivers saying, I wasn't comfortable talking about this, so the book was perfect. And I do think, and it's a larger conversation we don't have time for, that by coming in to talk about early adolescence, puberty, body change, menstruation, you open the door to other kinds of conversations. And so churches may be willing to promote puberty books that have content like that. They may be less comfortable with some content around other comprehensive sexuality issues, which are of course very important, but this is a way to kind of get your foot in the door, start the conversations. And so pastors, it was very interesting to hear from pastors and church leaders and others about why they felt that this is and this is something I have found in every single country I've done research in or been involved in, which is a lot, which is the universal discomfort of parents in talking about body change. And yes, there are exceptions, and yes, some parents are super comfortable, but across the board, they don't want to talk about it. And so I think by having a book that they can buy for their kid, or their kid brings it home and shows it to them, they can be there to answer questions or not. But I think that, and by having girls and boys both understand, and depending on the country, whether they should understand separately and then have a conversation or understand together, that's very specific. But I think trying to find these new avenues for reaching young people, particularly as some may not be going to school right now, but they may have this connection to their religious institutions. And so I think we just need to continue to be creative in terms of how do we start to have that conversation and break that silence so that people know where to get information and can feel more confident. So.
Thank you, Marni. I'm looking at the time. I really want to thank the panel for sharing their insights, inspirations, and also to you, the attendees, for these excellent questions. We could break the silence on menstruation really all day long, but it's only, we only don't want to take so much of your time. I really want to thank again the Case for Her and Diva International, DivaCares to make this happen. I want to thank you three to join the panel, Lindsay to manage the technology and the back end, and also to Carinne, your team, to set up the technology to make the streaming happening. I know that wasn't easy for all of us for the first time. And I want to conclude with wishing everyone a great Menstrual Hygiene Day on 28 May. Celebrate menstruation, share it with the world, break the silence. That's the day to do it. If not then, whenever. I mean, of course, 365 days also, but Menstrual Hygiene Day is really where the choir is the loudest. So you can join in whatever capacity, find free campaign materials on our website.